you, your families, and friends are all healthy. Jelena coordinated ARDI, Anti-Racism and Diversity Intergroup European Parliament. ARDI is a cross-party group of members of the European Parliament to fight against racism and for diversity. Acts of racism and xenophobia became more explicit and more frequent in the times of Corona. In addition, structural racism and inequalities should be impossible to ignore for everybody. We will hear today much more about the situation and about the suggestions for policymakers. I'm very glad to moderate this discussion. This is our second in a series of webinars that ARDI organizes with its society partners. We are very glad to have a great support by many different actors who are joining our seminars, and we were honored to host, for example, Commissioner ARDI, Director of Fundamental Rights Agency, advocates fighting against Islamophobia, anti-Gypsyism, anti-Semitism, and Afrophobia. And this time, we are honored to talk to European Network Against Racism, ENAR, including its members from Portugal and Belgium. ENAR is an anti-racism network that advocates for racial equality and facilitates cooperation among civil society. ENAR has achieved a great deal to bring racial equality on the EU agenda, and I am incredibly pleased to be partnering with you. This event is hosted by ARDI co-chairs, MEP Piret Herzberger-Fofana and MEP Evin Inzer. Thank you very much for hosting this event. I warmly welcome all of you and also those who are on Facebook and Webex. This time, we made sure to also have some time for discussion, which I think is very important for our audience. We will have a Q&A section to make it a bit more interactive. And when the time comes, you can raise your hand in Webex, or you can write in Facebook comment section at any time. We will try to answer your questions as much as possible. I will just say very shortly about the structure of the event because we are a little bit late due to technical difficulties. So shortly, we will start with welcome notes by the hosting MEPs. Then ENAR will present the data collection project and the interactive map. That is a unique tool that allows to bring evidence and solutions to policymakers. After that, we will have MEPs reflect to what I hear from ENAR. And at the end, our audience can pose questions to the participants. It is my pleasure to give the floor to MEP Dr. Piret Herzberger-Fofana, Chair of ARDI and a member of Greens in the European Parliament, for her introductory remarks. She is the Vice Chair of the Committee on Development and the Delegation for Relations with the Pan-African Parliament, and as well member of several other delegations and committees, for example, the Women's Rights and Gender Equality. Piret, please take the floor. Piret, I'm sorry, we don't hear you. Anybody else?
Can you hear me now? Hello?
No, it's very good, thank you.
It's good? You can hear me? Okay.
Your microphone is off again.
No? You can hear me? Yes? Okay, is it okay? Yes, is it okay?
Yes.
Is it all right? Okay. So, have I said before, I am very honored to host this discussion with you, my MP colleague, Evin Inzer. Dear European Network Against Racism, dear audience, thank you very much for joining us today. It makes me very upset to see that people who suffer racism the most are experiencing it even more now, while at the same time being very concerned about impact of the pandemic on their health, education, and other aspects of their lives. COVID-19 pandemic affects the most excluded severely, and the reason for this is persistent and structural racism. There is an increase in conspiracy theories, hate speech, scapegoating, and violent attacks committed by individuals. But there are also problematic official responses targeting specific minority communities. There is as well exclusion of the whole racialized community from emergency assistance. There is an increase in police violence. In France, for example, and in Belgium, 2 racialized young men have died at the hands of the police, and countless others have been violently arrested as a result of increased police powers and surveillance, especially in neighborhoods with high ethnic minority population. This is alarming. We MPs in ARDI will keep on working towards the government to finally acknowledge racism and its impact. The awareness is at a very low level when it comes to national authorities addressing racism and xenophobia. But many actors at EU level still ignore the obvious too. This is why we have to put our strengths together. I am therefore very glad to have all of you here. I would like to express my gratitude to all of you for sharing with us your valuable work and reflection. I wish the authority put at least 5% of the effort they put in fighting the pandemic to the fight against racism. Racism kills people too. In addition, it is not only racist acts that we witness an increase in the context of COVID-19. There is an increase in LGBT-phobic acts too. People with disabilities have it even more difficult. All sorts of phobias and isms surface more visibly. We have to act in solidarity and address intersectional discrimination too. We don't have data about the impact on racialized women and other groups experiencing intersectional discrimination in the face of COVID-19. Another reason that we must call for the collection of equality data disaggregated by gender and race at member state and EU level. In the UK, where equality data is collected, it was found that Black people are 4 times more likely to die from COVID-19 than white people, and Black women are more likely to die than from Black men. If we also consider that the majority of health workers who have died are from ethnic minority groups, we see clearly the devastating effects of structural racism in this time of COVID, and the reason that we must push for an intersectional approach to any recovery efforts. We must also remember the situation of migrant and asylum seekers. Oftentimes, migrant women are involved in precarious care which exposes them to high risk not only from the virus, but also exploitation. Then there are also migrants with disabilities who are deprived of access to vital services at this time. It is only an intersectional approach that will enable us to highlight and to tackle these challenges. I warmly welcome you, and I am very eager to hear from your recommendation and from your experience. And I thank you in advance. Thank you very much.
Thank you very much, Pierrette. I will just take a chance to apologize to our audience who are waiting a little bit for the live video. Now I have the page as well. As promised, you can follow live stream.
Thank you.
For sharing your remarks and especially for pointing out the intersectional approach, including institutional racism that are things that are not even mentioned often by institutional and many other important actors. Thank you very much. It is now my pleasure to invite MEP Evin Incer into conversation. Evin Incer is a co-chair of ARDI and a member of SNT. She is a vice chair of the Delegation for Relations with Palestine and as well member of several other delegations and committees. Importantly, being the Committee on Civil Liberties, Justice, and Home Affairs, that also reflects her interest in defending fundamental rights. Evin, please take the floor.
So thank you very much, Jelena, and thank you also for Pierrette for the introduction, and also thank you for ENAR for this co-organizing of this event. I think it's a very important and a very timely topic that we are addressing today. I think it was the Human Rights Commissioner of the UN who said something in the way that if we don't address democracy, rule of law, and human rights, and make sure that they're upheld and respected, the current public health emergency will turn into total human rights catastrophe. And that is for sure, for me, the situation that we are in right now. And of course, fundamental rights, it is a quite broad term. Rights of racial, ethnic minorities, of migrants, asylum seekers are all a part of the fundamental rights. Media and civil society organizations, for example, have reported racism, xenophobia, and intolerance linked to COVID-19 pandemic in most EU member states. And we know that this is nothing new, but it has been going on for many years, but it has escalated, unfortunately, during these times of crisis. During times of crisis, I think the weaknesses in our societies exposes more than during normal time. And we need to make sure to address the current situation in order for a stronger society and a society that holds together and where everybody have access to their fundamental rights. However, we don't know exactly how much the increase have been, even though we know that the increase is quite high. Familiar challenges related to reporting of official institutions continue now, and are even bigger. European Network of Equality Bodies, for example, talked about this a few days ago. They said that equality bodies did not get reports about Roma and LGBT people, for example, or at least that there are very few the reports, but they are aware that we know that both of those groups are affected quite a lot. For example, by people using the crisis to fuel hatred against them. It would be interesting also to check the Equality Bodies database in more details, of course. They have published their COVID-19 related data quite recently. And in connection to this also, what I found it's quite interesting is the talk that I have with ILGA Europe last week, where in that talk it became evident that the real situation that shows is opposite to some of the findings. We also know that the marginalized Roma people are suffering now disproportionately during these times, both Roma groups, but also LGBTQI groups. And in parallel to that, FRA also published a report last month about fundamental rights in times of COVID-19 or COVID. The report is very important because it looks at the actions of governments and at the impact of instances of discrimination and hate speech. We have in the parliament, of course, during several sessions now, or during the last sessions, tried to address the consequences, the COVID-19 itself, but also the consequences, the short and the long-term consequences. I do believe that we are far away from have done enough. So the work in the parliament, and not at least in the Libe committee, which I'm a part of, the work is continuing in order to defend our fundamental rights and to combat racism and the xenophobia and hate speech that is on increase right now. The results that most media and civil society reports are related to are related actually to incidents against people also of Asian origin, or those perceived to be of Asian origin. And this is because some people, especially the right, the far right and the right wing politicians and parties trying to link the pandemic to just China and blame the Chinese people for it. In that sense, it has also led to a growth of attacks against people with Asian origins. Typical incidents involve people being shouted at or insulted in public. Only one of many, for example, or many examples, and very disturbing example, is that children of assumed Chinese or Asian origins were harassed on the street and bullied at schools. The most severe cases of racist incidents involved even physical violence. There is also an increase in posts blaming refugees for the spread of the virus. Roma activists all over Europe shared on social media incidents of hate speech with regards to government measures, and we have to clearly state that they do limit those measures taken. They do limit our human rights and fundamental rights to an extent which will not have been reached in normal times. It is important, therefore, to ensure that these limitations are consistent with the legal safeguards. In addition, it is crucial to ensure that their impact on particular groups is adequately taken into account. And those groups that I mentioned are among those groups, the most vulnerable groups, and are among those groups who have been even attacked more now during this pandemic. Unfortunately, we have already witnessed not only serious lack of care about fundamental rights, but also international undermining of all fundamental principles by the EU governments, or by some EU government, I should say. One of the most serious cases is, of course, Hungary, but we also know that it's taking place in some other countries also, not at least in Poland. People also encounter racial discrimination in accessing goods and services. Politicians and public authorities are linking COVID-19 to certain minority groups and migration, as I was referring to and addressed just a few seconds ago. Media reports are full of scapegoating, racist, and xenophobia narratives. To conclude this, my input, I would say that racism and xenophobia have become more explicit, and they are more visible than during normal times at many different levels. I would say that this situation is unfortunately a reality in all diversity, in all of the diversity of the societies, and in all of the diversity of the hate speeches, violations, and the attacks that are taking place. I think it's important to have with us also that once again that the COVID-19 pandemic have shown how serious violations that are actually taking place also during normal times when it comes to fundamental rights. But what has happened is that those rights, those hate speech, racism, and so on have become even more visible during these times. And finally, I think I can promise that both me, Pierrette, and all our colleagues will take our share of responsibility to continue addressing these topics and the situation in the European Parliament, in our different committees, to make and push the Council and the Commission to work harder on these topics. to make sure to turn the situation around and make sure that we in the near future live in a European Union where the fundamental rights are being respected and not violated. And finally, also, again, a big thanks to ENAR and your national members for being a part of organizing this very important conversation. Thank you very much.
Thank you very much, Evin. Important remarks from our hosting MEPs that we also look forward to discussing also during the next panel. Our first speaker today is Juliana Santos-Wagner, a Senior Advocacy Officer at European Network Against Racism. She will tell us more about the ENAR's latest project, Interactive Map. Juliana, we are looking forward to hear your presentation. Thank you.
Thank you, Elena. Thank you, Dr. Pierret. Thank you, Evin, for hosting us. I will be guiding this presentation with the help of my colleague, Georgina, and we're here today to show you the results of our study on the impact of COVID on racialized minorities. Georgina, next slide. So when it all started, we, of course, as a European network working on discrimination and combating racism, we have, of course, a very serious concern. How this would be affecting then the minorities that we advocate for and the minorities that we represent. So we work under two assumptions in our advocacy work. Don't forget that ENAR is an advocacy organization, but that uses research and evidence as a motor for change. So what we decided to question ourselves and try to test probably two assumptions. So the first assumption was, would the minority groups be the most affected during this pandemic, this epidemic? And the second one, a second assumption, would structural barriers that were already pre-existing before the pandemic be a problem to fully access service and to safeguard rights? So how did we do it? You can go to the next slide, Georgina. We collected cases during 4 months from January until April of individual cases of people from racialized minorities all across the EU plus Turkey and the UK to see the results. We tried to see 6 categories, which were if they were being denied access to healthcare, if they would have no access to protective measures at work during the confinement, if they would have problems to access alternative housing, especially for those who were already living in very delicate housing conditions, denial of access to basic service, police abuse and police brutality, and of course, how hate speech would be linked to hate crime or not during the pandemic. So the results demonstrated and confirmed these two assumptions, that COVID amplified the structural barriers and amplified the previous violations of human rights that were faced by these racialized groups. We want here to highlight when we talk about racialized groups, we are talking about mainly of 5 groups. We are talking about the people of African descent, the Roma, the Muslims, the Jews, and migrants. And of course, the results also showed how it's important to analyze not only the specific forms of racism, to see how the manifestation of discrimination affect each minority, but also to see common barriers that are faced by minors, by these minority groups, to see where are the common struggles and where we can find and combine collective recommendations for positive change in the future. Next slide, Georgina. So our question is, are we leaving a pandemonium, or we'll open Pandora's box? So here, what we're trying to see is that these results were not a surprise. It just unveiled the latent structural institutional racism that were covered already by numerous reports, including the Shadow Report. So what we see was just an exacerbation of previous problems. They were already there, but they were very difficult to map and to make it as an evidence in a report. So now we're going to show you how the map looks like. I think my colleague will show you how interactive it will be in the website. So what we're trying to do is to embed it on the website, these incidents, categorized in these different 6 categories. So what you can see there is like for each dot, you can see cases either of police brutality, either of hate speech, either hate crime, either people who were prevented to access protective measures at work, healthcare, and we collected 191 cases. So each of these 191 cases are dots in this interactive map. So here probably you can see it better. So if you go there, you can take a dot, for example, police brutality, and you can give an example. If you want to see cases of hate speech, you can see in the country or in the category of hate speech, which are the incidents that portray this specific manifestation of racism. You can navigate in this map on our website to check each individual 190 case. So we invite you to just visit and go and take a look and to see how it works. And soon we will also be talking about a collection of a different data, which was on the collection of best practice. We also collect best practice of civil society organizations and member states, trying to deal in a very sustainable way with the COVID to protect racialized minorities. But now if I may come back to my PowerPoint, I want to highlight 4 main findings and try to portray how these the examples that we extract from the map. So of course, housing was one of the most problematic issues, especially because they come with 2 different angles. Either you have overpopulation, overcrowded spaces like asylum centers, detention centers, where there is no way that people can keep social distancing, or what you see are evictions and people being deployed of their accommodations and be not able to leave where they were. So here we see specifically migrants and Roma being the most affected because there is a lack of alternative housing. One of the examples that we would like to portray was the example from the city of Bologna. The detention center in Bologna, the migrants living there, they initiated an initiative that's called "E Coronavirus Non Discrimina." So they wrote to the public authority because they were seeing and they want to showcase that the overpopulation during the epidemic would not help the prevention of in the way people were living. So they were demanding for more changes and more support. So this is one of the examples that we collect on the map. Next one. The next one is, of course, one of the most delicate one. Our colleague Kathleen from the Ballon from Independent Forum will talk about the case of police abuse and police brutality. But again, once more, police abuse has risen and became a dangerous lethal. Because here again, what we see is the common trend that racialized minorities are over-policed and underprotected. I don't want to show you again, show it right now, a case of police abuse because it's going to be covered by my colleague Kathleen, but I want to show a case of racial profiling because racial profiling is also on the rise. So here I give you an example of racism in a stadium. So a group of Asian minority was expelled by the security of the stadium from a match from Bundesliga in Leipzig. And it was declared that they were being invited to leave because they look like Asians and they could spread the virus. So this is one of the cases as well that you see a lot of racial profiling linked to the situation of the context of COVID. Next one. Of course, you see racist speech as a scapegoat to disseminate hatred. And once more here, the Asian minority becomes the group on the spotlight. And what we see, of course, is hate speech is also a fuel for hate crimes. So in the incidents that we collect, many times you're going to see that people who were insulted with hatred speech, after that, they are also attacked physically as a manifestation of hate crime. I want to give you an example of hate speech, which is from Jessica, a Malaysian migrant studying in Tallinn, Estonia. When she was taking a tram one day and she was wearing a mask, she heard, "You Chinese, you bring the values." And she was just trying to, just because she was there in the public, wearing a mask, try to protect the collective, the society, and she was seen as a threat with prejudice and ignorance. So this is one of the examples that we see a lot of time all across the European Union. Next slide, please. The last one is, of course, the link of structural racism in the field of employment and healthcare. Here, what you see is like how COVID exacerbated the long-standing inequalities and vulnerabilities in these both sectors. I just want to show you a case because people of ethnic minorities and racialized groups, they are not only one of the most affected, but they are also one of the largest groups that were taking care in the health system of other people. So just to give you an example, in the UK, more than 40% of the medical staff are Black, Asian, and minority ethnic groups. So just to show that the caregivers and caretakers come mostly from the racialized group. I just want to finalize my presentation because I think my colleague Emmeline from the Casa do Brasil in Lisboa will talk about the situation of migrants, and my colleague Kathleen will talk about the situation of police brutality, and Julie will come with further recommendations. But before, the question I asked you, like, is a pandemia a pandemonium, or can we close this Pandora box? Of course we can close, but depends on what side of history you want to be. You, an institution, as European Parliament, European Commission, you want to use this data to reduce the negative short, medium term, and long-term impact on minorities. So is this data something that you can be useful to tailor-made, long-standing and long perspective, long-term solutions for racialized minorities that are underprotected over this last time, the last decades? Or they want to continue to ignore the unique needs and immediate actions to combat all forms of racism. So we cannot live in ignorance anymore. We cannot live in invisibility anymore. The data is there, but what we want to do it. So here's an invitation to you, which side of the story you want to be. So I leave the floor for my other colleagues, and I'm open to your questions in the end. Thank you.
Thank you, Juliana. That was a really brilliant analysis and I think very important project that you are doing. And a little bit later, your members are talking about the cases. We will also hear policy solutions coming from your colleague Julie. So I mean, it was very useful to hear first the situation more general and in such a systematic way. Thank you so much. Yes, I just want to tell you quickly, to tell actually our followers on Facebook, please don't hesitate to ask your questions in the comment sections. I see that we have already some comments on ENAR page. We are sorry, maybe it is a little bit less questions because we started a bit later, but I would like to encourage, because I see that we have quite some viewers to start to engage in the interaction with us. It is now my pleasure to give the floor to our next speaker. It's time now to hear from ENAR members. As I said, they are the advocates from the ground. I'm very happy to have Emmeline de Oliveira with us, who is the vice chair of Casa do Brasil, an association that provides free legal aid and social support to migrants. We have a representative of ENAR member from Portugal first. Let us now listen to Emmeline presenting cases about impact on migrants. Thank you, Emmeline.
Thank you, Jalina. Thank you all. So, honorable members of the European Parliament, dear ENAR members and civil society representatives. Firstly, I would like to greet all the participants and to thank the opportunity to be here and to give you an overview of the cases that arrived for us at Casa do Brasil de Lisboa, which is, as it was already said, an immigrant association in Portugal. But to understand them, it's important to understand what was happening before the pandemic. Initially, it's important to bear in mind that the Brazilians are the biggest immigrant community in Portugal. In 2018, Brazilians' nationality remained the main foreign community resident in Portugal, with 105,423 citizens, representing more than one-fifth of the total foreigners in Portugal. The figures represent Brazilian citizens with a residence permit, not counting those who are irregular, nor those who reside in Portugal with an European nationality. The most relevant reasons for granting new residence permits in Portugal in 2018 were family reunification, professional activity, subordinate or independent, and study. However, since 2017, Portugal has been facing a housing crisis based on real estate speculation, which has caused rental prices to rise exponentially, which has not been accompanied by rising wages. The housing crisis has affected all of these categories of migrants mentioned, but irregular migrants waiting to fulfill the requirements to start their regularization process have been especially affected. Added to this, it's worth to mention the professional disqualification suffered by many immigrants who, despite in having their diploma revalidated, sorry, I just saw that I didn't have the video. I'm sorry. So, as I was saying, added to this, it's worth to mention the professional disqualification suffered by many immigrants who, despite in having their diplomas revalidated, did not have their skills recognized, which pushed them into job precarity. Additionally, the inherent delay in scheduling appointments with the Foreigners and Borders Service, the so-called SEF, which, due to alleged lack of human resources, left immigrants waiting for 6 months or more to apply for the residence permits or to renew them. With the pandemic, the Portuguese government has implemented a series of measures to mitigate the social and economic impacts of COVID in Portugal. Among these measures, there is the well-known interministerial order that considered temporarily regular migrants who had applications pending at SEF on the date of the declaration of the state of emergency, the 18th of March. Although we recognize the importance of this measure, which placed the migrants on an equal treatment level at nationals as subjects of rights, we cannot fail to point out the gap in the legislation itself and in its implementation. The legislative gap lies in the fact that the mentioned order is dated of 27th March, but it's considered only those who began their regularization process until 18 March, leaving out these temporary protections foreigners whose process began after 19 March. Therefore, these people were exposed to all the abuse that a situation of irregularity entails, and that were deepening during this pandemic, since they did not have access to social support or benefits because they were not considered as regular in the national territory. However, it's important to bear in mind that since someone is working in Portugal, regardless his or her status, that person must be enrolled at tax and social security authorities and paying their respective contributions. This means that these irregular migrants probably paid their social security contributions, but they are out of the scope of the order and consequently out of the scope of the social benefits because a matter of time frame. We knew cases of Brazilians who were obliged to keep on working at the company to do not lose their jobs while their colleagues could work from home, and they because they were nationals or foreigners in a regular situation in Portugal. Also, we knew cases that immigrants were the first ones in their companies to have their work contract suspended or finished, remaining without job and without unemployment benefits due to their administrative migrant status. By other sides, the implementation gap refers to the bureaucratization and sometimes unpreparedness of civil servants to the exceptional situation, which includes pandemic and temporary regularization. Thus, we knew cases of immigrants who were unable to access the number of users in health centers because they claimed it was not necessary if they were not infected with COVID. Cases of people who, despite the extraordinary legislation not allowing evictions, did not have formal rental contracts due to the mentioned housing crisis that I said. So they were not protected by such measures. And due to the professional disqualification, many immigrants and specifically many Brazilians were active in services, mostly related to tourism, such as restaurants, accommodation, and tour guides. And this was one of the sectors most affected during the lockdown. Therefore, many immigrants were in extremely hardship without the conditions to guarantee their own food and that of their families. With the reopening of the country and the commerce, we hope that the situation will stabilize, but it's still important to create long-term and target measures for working migrants, regardless their administrative status. Also, it's still unclear that what will happen to the rights acquired during the temporary regularization. Will they be withdrawn after the appointment scheduled by SAF, since the migrants will no longer be considered regulars? For those who are irregulars and lose their jobs, will be any flexibility regarding the accomplishment of their exits to have a residence permit grounded on work activity? I finished this presentation expressing that we, in Casa do Brasil de Lisboa, hope that all migrants will still be seen as subject of rights, with specific social protection policies in the law and in practices, during and after the pandemic, and so on. Thank you very much for your attention.
Thank you, Emily, and thank you very much for this important presentation. We are now thrilled to have with us Kathleen Vandendaal, Senior Advocacy Officer and Minder Hedden Forum, which is ENAR member from Belgium. Hedden Forum is recognized by decree as the advocacy organization for ethnic cultural minorities in Flanders and Brussels. They represent more than 1,000 racial ethnic migrants associations in Flanders and Brussels. Kathleen will present a cases of racial profiling. Kathleen, thank you for being with us.
Okay, hello everybody, and thank you for this invitation, and of course also sharing all of your expertises. They asked me to talk about police brutality in times of COVID-19. I will share two concrete cases and then highlight the most important challenges we think to tackle in the current situation of COVID-19. I will share, therefore, a presentation. Content. Just a minute. I had some general remarks, but I think Dr. Pierrette and Evan and also Juliana already mentioned a lot of them. Of course, COVID-19 goes broader than police brutality. Some measures, of course, they are the same for everyone, but they don't have the same effect on every citizen. And of course, the application of the measures are not the same for everyone. We will see it in the cases of police brutality, where, for instance, local surveys, they show that minors with a migration background, they get stopped all the time by police asking, is it a necessary displacement? What are you doing here, etc. And other minors, let's say blonde and blue-eyed, they gave to local surveys that they were never stopped once during the actual COVID-19 time. So I just wanted to highlight that the application of the measures is not the same. Of course, we talked about the larger visibility now that some inequalities already existed, but there's a larger visibility, and there's also an increase, I think, of the scale of expansion of those same inequalities. We already mentioned, of course, that racial communities are at large vulnerable in the current situation, but some of the target groups within those racial communities are in a particular vulnerable situation. And think of single women, mothers, undocumented people, minors. We talked about the intersectional elements in this case. And of course, the human cost now and the human cost in the future, social, economic cost for individual, for the relatives, and the relational network and society at large. Because already now we see in local surveys, or we already see increasing figures in the context of discrimination within housing and labor markets. So there will be also the effect in the future, of course. But those were some general remarks I had. They were already illustrated by the other speakers. Anyhow, in case of police brutality, we can now see that you can't get rid of the idea that the police only controls, like an over-policing, and not so much protects, and certainly not towards all citizens. So the item of under protection of minorities. And the cases I will explain or I will share illustrate that the police officers, they are taking risks that endanger everyone for the sake of control and the exercise of power. The groups that were already struggling with over-policing, with police brutality and ethnic profiling before COVID are now also the hardest hit. Exact formal statistics on police brutality incidents in Belgium are not yet available, partly because we are in the middle of the situation, because willingness to report, of course, is very low. And also because the reporting, monitoring, and follow-up of such incidents in Belgium is very fragmented and not transparent. But we do get a lot of signals from civil society, of course, that there's a huge increase in incidents, but I think the mapping of ENAR illustrates that very well. For both cases that we will discuss or that I will share with you, the investigation and our reconstruction of the facts is still in progress, but it doesn't need to stop us thinking about the challenges it brings to the surface, and it doesn't need to stop us to think about possible solutions, of course. So the first case I want to share with you is the death of 19-year-old Adil. Adil was a 19-year-old young man. He lived in Brussels in a working class neighborhood, Anderlecht, for those who live in Brussels. So Friday evening, the 10th of April, he and his friends, they took a ride on their scooters through the streets, but they were spotted by a police patrol. Adil, who don't want any problems, ran off, and which the police started or decided to start a chase and asked for reinforcements. Then a second police patrol approached the driver in the opposite direction, and the police car intercepted him by driving him front-facing into the scooter. So he died at the scene. as a consequence of his injuries. And Adil had no criminal record, was not a problem child. Everything went well at school. He was just like a young adult hanging out on a Friday evening. His death has led immediately, the second day already, to a lot of tensions between police and communities. It goes on up until today, with a lot of anger amongst youngers, a lot of fear amongst parents. So it's also very interesting to know that his case is not the only one. He's already the fourth person in 1 year and the ninth person in 7 years killed by police during a police pursuit. So that is the case of Adil. Then I have a second case, and then I will go to my recommendations, and then you can understand the link between all cases. So this is the case of Paola Andrea. I will first show a video. I will stop it in the middle because it's like 4 minutes. So I will stop it at 1 minute and a half or something. And then I will explain the case. I warn you, very, very heavy images. And we show them with the consent of the victim. So I stopped the video here because it continues in this way for a very long time. I think this is really, it shocked me when I saw this, but I will explain the context. On Friday, the 8th of May, a young mother, Paola, and her 9-year-old son, they are going to visit a very good friend in Antwerp. Later in the evening, the police receives a complaint from another resident about noise. And more or less 13 officers, including drug dogs, they arrived at the entrance. Police officers invaded the apartment, turned off the sound, and aggressively asked for the identity papers. In protests of the aggressive approach of the policeman, the victim we see in the video makes a hand gesture and an insult. On that moment, police officers jump on her, push her to the ground, places an arm around her neck and gives her electric shocks on her legs and other parts of the body. So Paola is repeatedly beaten in the face. She's handcuffed and eventually dragged to the bedroom. The policeman repeatedly lies down on the woman, stands against her, etc. So it's unclear what exactly happens in the bedroom, where the victim is together with the two police officers. You see them putting on latex gloves. But when Paula comes out of the room, she is no longer fully conscious. So all this happens under the eyes of the two underage children, 9 and 11. They are filming what's happening from that moment on. The moment that she's dragged away from the apartment, so the night from Friday to Saturday, she until she wakes up in the cell on Sunday morning, she has no memory whatsoever. She wakes up completely stripped, naked, completely naked, stripped of all clothes. No trace of the upper clothes and shoes, and she was introduced barefoot for the investigating judge on Monday the 11th. So she's now free on parole, and she is charged with violating the corona measures, spitting on a police officer and beating authority, all facts that she can't remember and where there are no witnesses. So in addition to these two cases, I can also add that there are a series of incidents such as an increase of the number of communal fines, illegal communal fines, so facts that were described by the police that did not happen, click lines to the police, or telling to the police, for instance, that your neighbors are trespassing the measures. Of course, increasing in hate speech, but also illegal house searches from people who were suspected of having stayed in their second home or not belonging there. I think what all these cases make very clear is what I told in the beginning, that rules are not applied in the same way, and they make the existing inequalities and the phenomenon of ethnic profiling even more visible and extensive. So several fundamental changes, I think, are needed to counter those incidents. I will not go into every recommendation, but I just wanted to highlight some of them that seem to me to our organization as very important. And there's the first one, who has a specific relationship to the COVID-19. So specific due to the corona times, we have the extension of the police's discretionary powers. This is a situation in which policemen, they have the freedom and authority to interpret the rules and the laws by themselves. So it gives them a big deal for maneuver, for interpreting the law. So on the 23rd of March, we had also a ministerial decree that designed the new guidelines. And enforcement of that new law had to be done by the police. But they were given a lot of room to do that. And they were also given permission to use force or violence when the corona measures were violated. And it increased their power, of course, but also it caused a lot of confusion, especially among the police. And it created like a police chaos, which you see differences between local authorities, individual police officers, local police forces, and so on. Research shows also that the more discretionary powers agents are given, the greater the chance they are ethnic profiling on a regular basis. So the lockdown shows, and the cases, that they show very well the negative and even dangerous side of an enforcement that lacks on clear guidelines. And that is why civil society in Belgium is asking for clear guidelines on discretionary powers. For the rest, I just think we have like recruitment, that's logic, more diversity, faster through flow, longer training periods, local recruitments, a strong police training with diversity training, implicit bias training, street culture, recognition of discrimination mechanisms, victim assistance, peer review, dealing with minors, all this together with civil society. It's important to know that everything I'm telling you now is missing. It doesn't exist now within police structures in Belgium.
I'm sorry to interrupt. Wrap up soon, please.
I'm sorry?
Would you be able to wrap up soon, please? I'm sorry to interrupt.
I wrapped it up. It's finished. Just like, of course, accessible, independent, and effective complaint mechanism. Now it's really a chaos also. Internal framework for minors. because a lot of minors are into some incidents, so there's in the need of a specific framework, and of course the registration of ID control.
Thank you very much. Thank you for so many practical information, and it is at the same time heartbreaking and also outrageous. And it is important for everybody also to hear and to see what is happening. Our last speaker today is Julie Kaskar, Senior Advocacy Officer at European Network Against Racism. Julie will present recommendations and solutions based on the work of ENAR. Julie, we are very excited to hear your presentation.
Thank you very much, Yelena. Thank you very much, dear member of the European Parliament, for hosting us and co-organizing this event with us. So after these brilliant presentations and analysis of the impact on racialized communities in Europe, I just wanted to bring some ideas of solutions as ENAR. Indeed, we are, especially at the secretariat level, we are, so I will try to share my screen now. So we are working specifically on what the European Union can do at its level, but also what it can do to push member states in the right direction when it comes to fighting against structural racism. So first, as a general approach, we have been calling for some time now the need for the European Union to change its approach in the fight against racism. This crisis, as any crisis, is showing what is going wrong in our society. And here, as we have already mentioned, structural racism is really like blatant, even more than before. So it's really kind of a unique opportunity to adapt public policies in the fight against racism. And we see that current public policies, most of them are not having structural racism as a focus and are missing the point when it comes to adequately tackling racism and trying to eradicate it. We also need to ensure that we are intersectional and not only looking at some minorities at the expense of others. And we have also seen this tendency at the EU level to focus on some minorities, and actually this is contributed to invisibilize some others. So when it comes to structural racism, having it as a focus in public policies, this is crucial. As we have heard, the structural barriers are the most important barriers and the most severe obstacles that racialized communities are facing. And when we talk about structural racism, we talk about what is the kind of racial discrimination that is recurring in every areas of society. It's part of how Europe has been constituted historically, and we really need to try and tackle that in policies. A second really important element in order to change the approach in the fight against racism is to finally and to push even more member states to collect equality data disaggregated by race, including ethnicity, migration background, religion, etc. Because we know that we have seen that actually, I mean, as ENAR, we have tried to do our job by trying to show a snapshot of the different cases that are happening in Europe. But the thing is, we don't have proper and equality data that is comparable from one member state to the other. We see that the UK has this equality data collection measures, and we have heard about this really unique study on showing how Black minorities have been impacted by the Covid-19, and actually it's leading to a specific governmental inquiry because of this data. So we see that actually the lack of comparable and equality data are actually making this issue even more visible, and this is quite blatant in the discourses of policymakers as well. So we really call for the European Commission and the EU institutions and the European Parliament to also continue to work toward more systematic equality data collection measures. We have these guidelines that have been issued by the European Commission. We really need to see how we need to use this and to continue encouraging member states to go towards this direction of collecting data. This is really crucial. When it comes also to public policy, like so what we call racial equality mainstreaming, meaning we need to be much more intersectional and looking at how mainstream policies can benefit to racialized minorities. And this is still not the case. A lot of mainstream policies are only designed to serve some part of the population, and there are no specific acknowledgement, no specific measures for racialized minorities. So we need to have we need to have this mainstreaming as much as we've had it on gender. We need to have it also on racial equality. And finally, in order also to ensure that this mainstreaming is happening more and more, and to ensure that we are correcting the existing inequalities, we need some more positive action. We need group-specific policies in order to correct these inequalities. And this is allowed also by the EU law, so we shouldn't, but it's quite underused, so we shouldn't refrain from using them. So really quickly on racial equality mainstreaming, like trying to detail a bit more, especially in this context of COVID-19. So we have heard that there have been new emergency funds adopted, that some funds, existing funds such as the structural funds, have been adapted and made more flexible in order to respond to the crisis. We need to have specific allocation criteria for racialized groups, and not only Roma, but also like Black communities, Arab descent communities, Muslim communities, Latin communities. So we really need to have a better. We need to ensure that there are these criteria to actually ensure that all racialized minorities, all groups at risk of racism, are taken into account specifically in these funds. When it comes to recovery plans as well, we need to also have specific measures that are addressing the issues for racialized groups. Now, ENAR has, and many of our members have intended to gather data. We know what's going wrong generally, and we need to ensure that this is addressed specifically in the recovery plans, and in order to tackle structural racism. This is a unique opportunity. Another very important approach is to establish strong consultative mechanisms. It's not ongoing in all member states, but we really need to ensure these consultative mechanisms are also including racialized communities, because we have seen how they are specifically impacted. So we really need to ensure that these groups are included and they are heard, because they are also voicing the specific concerns of their constituencies. And finally, when it comes to mainstreaming, again, we have really, and this is increasing, like research programs on looking on the impact of COVID-19 in many different areas. We really need to ensure that there is a specific priority on racialized groups, how the impact of COVID-19 crisis have been on these racialized groups, as much like similarly to what have been done in the UK, which is really actually quite telling. On group-specific policies, this is something that ENAR has been calling for some time already, to adopt or improve when there are existing national action plan against racism at the level of member states. These are really crucial. This is really a crucial tool in order to include specific measures and to have a more comprehensive, a more structural approach to racism again. So not only ad hoc measures are only related to the political will of the moment, we really have a specific policy on this issue. And this is really actually quite astonishing, to say the least, that we don't have it in all member states, and that the EU is still not also taking the lead on that. This is also what we call the EU institutions to do. You should work on having specific standards for member states on national action plan against racism. And this action plan can and maybe our members could say even better than me, but this action plan can include measures on improving racial equality, racial diversity in institutions, ensuring regular discriminatory testings in areas such as housing, measures to recognize historical persecution, etc. Another specific policies that are related to groups as well is and actually that's what Kathleen mentioned, is how to ensure to have guidelines or specific measures against racism in the police, because this is and we have seen it via a project as well. This is a major issue. So we really need to explore how to have specific policies at national level and also at EU level on this. And also related then to migration, we have heard that migrants and specifically undocumented migrants, asylum seekers have been really the most impacted by and the most vulnerable in this crisis. So we also call for granting and extending resident permits to undocumented migrants without any conditions for work, because we know that many of them have lost their work or are at risk of losing their work. And finally, we also call for establishing firewall rolling protocols for undocumented migrants to ensure they are protected and they can access basic services, including healthcare, in these times of a sanitary crisis. And then I would like to finish by and use this opportunity that we have this dialogue with ARDI, which is a major intergroup and a crucial intergroup in the European Parliament, to highlight some specific recommendations for the member of the European Parliament and maybe explore together how we can advance on this. So first, as I said, we need to ensure that there is this understanding and this acknowledgement of the major impact on racialized communities of the crisis. And so far, this has not been the case. So we would like to call for the adoption of a resolution on the impact of COVID-19 on racialized groups and the need for national action plan against racism, because we believe this is one of the main tools. We have seen lately one resolution on the impact of COVID-19 and the EU response, and there was no mention of racism, no mention of specific measures against racism. This is absolutely not acceptable, considering the data and the major impact that we have just presented. A second element that we would like to call the members of the European Parliament to work on is to engage on EU recovery plan and EU budget discussions. Maybe you are already, but really to ensure that there are a specific discussion on specific measures for racialized groups. And finally, there is actually discussions around the new migration package. We really need to ensure that the specific impact on migrants of the crisis are included, and we are ready also to discuss with you on how to ensure that this is taken into account in the next package. So I'm really looking forward to work with you in the European Parliament on these different recommendations. And I'm also happy to hear any questions from our audience in order to also to hear about what they see as priorities in their different countries. Thank you very much.
Thank you, Julie. Thank you very much for very, very well informed suggestions. Some are old. We have already talked and worked on this so many times, and some are new. Thank you for being also very specific and suggesting specific things to the MEPs. I think, unfortunately, we don't have much time because we started a little bit late, but there will be, of course, another opportunity, and I think definitely a follow-up with an advocacy meeting with ENAR as soon as possible would be a good idea. Now, I would like to ask MEP Evan Intir and Dr. Hesberger-Fontana, if you have 2 minutes, or if one of you has to leave, then we would give this person a priority to speak. Also, now I don't hear you. I don't hear you. Maybe you have to unmute your microphone.
You hear me now?
Yes.
Can you hear me, please? Okay. Also, thank you very much for all those very, very wonderful and interesting recommendation and presentation. It was for me something new, for example, that in some member state there is no diversity training for police and so on, because in Germany we start with that, and I think is a big problem. Since you gave a lot of recommendation, and I think my colleague, I can speak in the name of my colleague, we are all so we are going to look at all those recommendations and try to put them in the parliament, to bring them in the parliament. As you said that, for example, in the recovery plan, there is no mention on racism, but I am sure we put it. We made an amendment, but that time, and we put that, and we said that racism, and especially we put it on the racial profiling, have to be, as I mentioned, in the recovery plan. How we all say that the virus have no border and also don't discriminate, and it means a lot of people have been now sick because of the COVID-19. What is important for us as a MP, and also we want to work with you, is that we have to act, I think, together and show solidarity. Because if we can't, if we succeed to work together, I am sure we are going to it will be able to slow down the spread of the virus. And the values of diversity, the values of respect and inclusion are at the heart of the EU and must not allow racism, intolerance, discrimination, and xenophobia to flourish. That is our target, that we don't want them, and we are going to work in this thing. We must ring then in this thing, we must ring the alarm bell so that the race does not increase during this period of crisis. I thank you really for sharing your knowledge, your experience, and the recommendation. And we are going, I suppose, by the next meeting from ARDI, we are going to look at those recommendations. I write them down, and I think we are going to get the recommendation on the paper, yes, so that it will be possible to do something. What I have just one point. You speak about the research, yes, and I think that is really important that we get data. Until now, it's just UK, but UK is no more in the European Parliament. So it means the other countries we have to collect data so that we can make a recommendation and we can make amendment to how are we going to work in this, how are we going to work to combat racism in Europe? Thank you very much, and I thank you very, very much. It was really, really interesting, and I hope we are going to get all those presentations. For us, it's very important so that we can say is our purpose, but is also the purpose of the civil society and the purpose of ENAR. And ENAR, as everybody knows, work a lot since many years. Thank you.
Thank you very much, Pierrette. It seems that unfortunately we lost Evan. Probably she had some other obligations, but I'm quite sure that Evan would very much like to follow up with you and that she got a lot of important information from this event. So now we want to finish at 3:30, but we have few questions that we got on Facebook. And maybe to be able to wrap up fast as we almost as we planned in terms of timing, we can put together our participants' final messages to the audience with reflecting very shortly to some of the questions, if that is okay for you. And of course, not everybody has to answer these questions. So now we will have a final round. Please share with our audience a final message that you would like general public to hear. But also, if you wish, you can reflect on, let's say, 2 questions, because unfortunately we don't have time, so we had to select. One was a question that I tried to put together, a question based on several questions related to France. One participant asked, how do you deal with this in France? Probably, I assume that he or she thought about racist policy making, as well as colorblind approach of the government. So maybe you would like to reflect on this. As well, there was a very important comment from our colleague from Muslim Women's Organization. I'm sorry, I just need a little bit of time. Yes, Sana Bilic said in France, a Muslim woman can be fined 165 euros for covering her face, whilst at the same time, she can be fined 135 euros for not covering her face in public. A choice of material is where the hypocrisy lies. Sonia is referring basically to long-term measures of the French government to forbid the visible identity of Muslim women, and also to new government COVID-related measures related to mandatory mask wearing. So if you would like to reflect on this problem, I would be glad. Also, Melissa Sonino commented on reporting. That is something that MEP Evan Insier mentioned, the problems with reporting of racist acts to official institutions. Melissa Sonino said that it is enough to remember that only a small percentage of those who are victims of bias-motivated attacks, discrimination, report what happened to the authorities of victim support centers. So I think this is why it is very important to have a civil society data collection and sharing basically civil society experience as well as personal experiences. Thank you very much. Maybe we can start from our first speaker, Juliana. What would be a message that you would like to send to our audience for the end?
Yeah, I think I'm sorry, I didn't hear well your questions, but I think one of the most important things is to understand that civil society is there to be the example of solidarity, and we should multiply this example of solidarity to give hope. I think it's not, we should not believe that we're living in a hopeless time. I think we should believe that there is always a way. And who knows, this was the necessary friction that we needed to really unveil the solutions against discrimination and racism. I just want to give a message of hope, and we need to adapt to the new normal, and the new normal would be also interesting to see a society without racism. So that's my message, and I'm glad to together with my colleagues to answer to the questions on Facebook later on. I'm so sorry I didn't hear it well. Thank you, Elena, for your work.
Thank you, Juliana. That's not a problem. I think it's, as I said, not necessarily that everybody reflects. It would be probably too long. So our second speaker was Emmeline. Emmeline, can we have you?
Yeah, sure. But I have the same problem as Juliana. I did not understand very well the questions. I'm so sorry. It was a lot of cuts. But I do also agree with Juliana that the time that you are living now, solidarity, it's the main key word. You just have to be together and look against the xenophobia and racism as well as you did before, but right now deeply and believing that we can change the things if you stand all together. I hope also that we can also unveil some actions that have been taken by some people in the countries. For example, in Portugal, we during the pandemic we just found out a Facebook page called O Bom Europeu, which means the good European. And this Facebook page started to say that they are quite happy because right now the pandemic started to make people, migrants, coming back home. So this is a good thing. And right now we are trying to report the situation and try to receive any a reaction from the authorities. And I think if you stand together, maybe you can find an answer, a good answer for it, and start to fight against xenophobia and racism. So thank you again for the opportunity to be here, and I'm sorry for do not answer direct to your questions.
That's not a problem. In the meanwhile, I also learned that some of the participants heard the questions, which is very good. So can we hear now from Kathleen, please?
Yeah, hello. I had the same problem with the questions, but anyhow, what I wanted to say is I don't know who the viewers are, of course, if it's civil society, if they are individuals from migrant communities, etc. But the only thing I truly want to give to viewers, it's really concrete. It's the right to film, to put a complaint, because a lot of things are happening without witnesses, under the radar, and that gives a lot of problems to really make it even more visible. So the right to film is there, and I would ask everyone to do it and to put a complaint as much as possible, because we know people are not really willing because of the lack of follow-up and that, but it's necessary for the figures. And as Dr. Pierrette already said, to make change happen, we need these figures also. Voilà.
Thank you very much, Kathleen. Julie, can we hear your final words, please?
Yes, thank you, Jelena. So I can try to bring some elements on the different questions. So first on France, I'm not sure exactly what's the question, what was being focused on, but at least I can answer from the EU work perspective or advocacy at the level of the European institutions. There are some initiatives and some spaces at the EU level where different countries gather. And this is really important. Because, of course, different countries have different approach to racism, and France has this really strong colorblind approach to racism, and that's making it even more difficult, because at least some countries they acknowledge there are different racialized minorities. They acknowledge we need to collect to some extent data, but France is not even there. But I really want to emphasize on the fact that the EU, with all its limitation, has this with really good also civil servants have this potential to increase the peer pressure and to increase pressures on countries on different kinds of measures. So, for example, the high-level group on racism, which is a gathering of different countries working on racism, has had at some moments like countries presenting what they are doing on racism, including on National Action Plan Against Racism, including on policing, etc. So this is also, as ENAR also has a strong network, we manage also to bring our members in these kind of discussions, and this is really helping sometimes to have different kinds of countries. So I just wanted to bring this EU added value in this kind of discussions, but of course it's very complex and difficult. On the face covering issue, indeed, this is quite a blatant example of structural racism and how policies are enacted with a racist perspective. when this law was adopted on prohibiting face covering for Muslim women, they didn't use, of course, the word niqab. They didn't use the word face cover, veil. They didn't use this kind of words that would have be seen as discriminatory. They couldn't actually. They used face covering. But we knew that in practice and even in the political discourse, this was targeting, of course, Muslim women. And now we need to cover our face, which and now it's even like obligatory in some moment, in some aspects, etc. So you can really see that depending, and Kathleen was saying it, depending also on the communities that is actually having a practice, or that is deciding on having a practice, that you are like you are sanctioned. And because Muslim women are also minority, because there is pervasive racism, this law was able to be adopted to target a specific community. And now that you have of course a global sanitary crisis, this is not, and affecting everybody, then this is not the same story. So I don't have a proper solution on how to deal with that, but I just want to say that this is really one of the examples showing how policies are really, can we say, racialized policies, like that is really targeting, even without saying, targeting a specific community. This is what really shows us. And finally, on hate crime, I didn't hear specifically the question, but I wanted to highlight the importance also, when we discuss hate crime, of looking at what is preventing people from reporting hate crimes. And this has been sometimes the issue in the EU approach. There is a strong focus on hate crime at the EU level, which is normal, because this is one of the most severe acts of discrimination. This is leading to, of course, this is can be lethal, can be so violent, brutalizing people, etc. So this is really severe, and we don't deny it, but we shouldn't only focus on this. And especially when we look at hate crime, we need to look at structural barriers that are preventing people from reporting hate crime. And this is what we want to and this is why we think that a change in EU approach, looking at structural racism, will help actually fighting against hate crime. Because people will feel safer to report to the police. People will have more access to different areas of life. So it will be really like also this general approach will help much more. And finally, just to share a final comment, of course, I'm really happy that the members of parliament are welcoming our recommendation. I forgot to mention that we will publish our policy paper today or tomorrow, highlighting all these different recommendations, and we of course are ready to, continuing our really special relation with ARDI. And I just want to say that really ENAR will try to continue to do its chair to raise visibility of the issue, and also build solidarity across groups. I think this is also what ENAR is, where ENAR is best placed, is that we have such a diversity of members representing different groups, and this is more than ever, we need solidarity across all different groups.
Thank you, Julie. I think, yes, you got very well the question about the friends, and the other question about bias motivation. It was more a statement. So thank you for your reflection. And now, MEP Dr. Erzberger from FANA, would you like to send some final message to our audience and our participants?
So you listen. You hear me? You hear me? Yes. So I know how much ENAR has lobbied toward institutions to address racism and approach the problem from an intersectional perspective. And I know how your work is very important. And I wish to offer my support to you in fighting this important fight. I think together we will be strong. Thank you very much for sharing all those recommendations.
Thank you very much. Thank you all participants, and I would like to thank also our friends from ENAR who were not so visible, but these are Sanka and Georgina from. I thank you for cooperation during the preparation as well as all the other work that you have done, including communication work around the event. Thank you all for watching. Stay safe, and I would like to promise you that we will go more in detail through your comments on Facebook and through your questions, and we are happy to connect with you online and respond to you in some other way, because yes, unfortunately at the beginning we had some technical issues and we apologize for that, but I hope that this event was useful for our audience too. Thank you very much. Have a nice day.
Thank you,
The rest of the day.
Thank you.
Bye-bye.
Bye.